Hi, I'm Peter Walker. I'm the rep for the voluntary sector on the Health and Wellbeing Board in Bristol, and reporting back on the meeting on the 28th of November. A long meeting. First of all, I want to say that the Health and Wellbeing strategy, which we talked about, has been in the making for the last 18 months or more, is now being published, and here it is, and you can get a copy by going on to the by emailing effectively health at bristol.gov.uk, or you can see a copy on the website of bristol.gov.uk/HWB, Health and Wellbeing Board, I'm sure that means. So there we are, that's it, if you want to look at it. Moving on to the agenda of the meeting on the 28th of November, a number of papers, quite a long meeting. You can see a substantial amount of paperwork generated by these meetings. The first paper is around an alcohol update, looking at the commissioning of alcohol services in the city. Obviously there have been some changes recently with the new drug and alcohol service recently commissioned, and looking at various other initiatives around health promotion, both in schools, in part of the education curriculum, which picks up alcohol information and awareness for young people, and various prevention issues, other prevention issues. It was a general overview of what's happening currently. Obviously, there's serious concerns around alcohol misuse in Bristol, with large numbers of people in the city considered to be drinking at harmful and hazardous levels. One of the key issues recently has been about introducing a minimum unit price for alcohol, and again that was discussed at the Health and Wellbeing Board without any firm conclusion, it has to be said. Obviously government policy is not to introduce minimum unit prices at the moment, although Bristol is part of the core cities groups in the country which is looking to lobby for a minimum unit price. Number of comments around the sort of presentation from various board members, including the chair, and at the end of the meeting it was agreed that the situation in Bristol would be kept under review, that the further report back on alcohol approaches and interventions in the city should be brought forward with clear outcomes identified, i.e. how is the performance being measured, and concern about gaps in provision within the city, and the need to identify what other agencies need to be involved. There is talk of an alcohol alliance being created in the city to bring various agencies together to look at the issue of alcohol and the various interventions that can be made jointly to try and deal with some of the issues that come up around alcohol misuse. And moving on, there was another paper from the Police and Crime Commissioner's Office around the commissioning victim services. The Police and Crime Commissioner now has responsibility for commissioning victim services, and there is a consultation paper out at the moment. They're waiting at the moment for further guidance from the Ministry of Justice before actually setting out clearly the commissioning intentions and the commissioning path. So it's one of those, clearly watch this space. One of the big papers of interest to many people in the voluntary sector was the paper on social prescribing, which had a very positive reception at the board. The idea of a more holistic approach, particularly targeted at very vulnerable people. There had been some an academic paper setting out information about what social prescribing is, and the potential benefits of social prescribing. As I said, the CCG has already committed a pot of £100,000 for social prescribing. They're looking for the city to contribute further to that pot. And the meeting agreed, as I say, after a very positive discussion about the benefits of social prescribing, to establish a working group to take this forward. And VOSCA, you'll be pleased to know, is going to make approaches to public health with a view to getting involved in that working group as a means of influencing, hopefully, the outcome of some of those discussions. But anyway, very well received and generally well supported. Moving on, there's a big pot of money, it would seem, £3.8 billion, which has been set aside, well, not set aside, it's been identified by the Department of Health for what's called the Integration Transformation Fund. This is building on money that's already identified in the NHS budget to transfer to social care, and this is basically trying to increase the pace of joint work between health and social care over commissioning services. This isn't, has to be said, a constant mantra. It's not new money, it's money that's already committed in the NHS. And anyway, there's going to be a plan. There's been the Department of Health is looking for a plan to be developed by the 15th of February for basically moving this whole agenda forward. And the post has been agreed to develop this plan by February the 15th. It's a major piece of work. Obviously the plan will just provide the outline. It's a major piece of work to take this forward, and obviously potentially will transform many services. And there already in the country there are a number of pilots going on around this transformation fund, work between health and social care, and the whole progress of this will be informed by those pilots. So big piece of work, and look out for that plan around February. The Joint Strategic Needs Assessment, the piece of work, the research around needs which informs health and wellbeing strategy, the Health and Wellbeing Strategy, and the work of the Health and Wellbeing Board and others, has been updated, and again details of that on the Council's website. And generally the update indicates some generally a picture of an improving position. However, it's pointed out during the discussion at the meeting that some of those improvements basically disguises the basic differences between different parts of the city. So some improvements, but perhaps not generally an accurate picture for some of the areas that are suffering higher levels of deprivation. Well worth looking at that website. Look at the the various results. The number 40,000 unpaid carers in Bristol, worth noting. Basically, rising price of healthy food, the food rising in price rather, while nutrition got worse, and 1/4 of children in Bristol are growing up in households unable to afford or have access to food to make up a healthy diet. These are fairly salient statistics and well worth looking at. Moving on, some technical stuff really. The Health and Wellbeing Board now has responsibility, we're told, for commissioning a pharmaceutical needs assessment. That is evidence basically which determines how many pharmacies or where pharmacies are set up. So that's a piece of work that's got to be done by the Health and Wellbeing Board. And moving on again, there's a paper on Bristol's response to the National Autism Self-Evaluation Questionnaire. In 2010 there was a national strategy for autism, and Bristol developed a strategy subsequently, and the self-evaluation is on the back of that. And basically the feedback is suggesting that the Bristol strategy is pretty well in line with the government strategy. So no particular concerns there. Finally, there's again a piece of work around that's going on. It's called a call to action from the health service, and basically there's something the CCG is collecting views on, and it's really views about the NHS as a whole, and they're posting various tweets on Twitter to seek in views on the health service, and it does cover everything really, from sort of the views around GPs and the way GP services are organised, right through to things we've just talked about integration of services and future opportunities in the NHS. It's quite a big agenda really, and again, it's likely that Vosca will be doing something specific on this very shortly, and look out for that in their newsletter. And that's it really. The next meeting of the board is an informal one in January. There's going to be a meeting with some of the big providers of health services to seek their views and consult with them. The next public meeting is in the spring.